It is important to note that no child should experience starting their menstruation cycle without some information regarding that this will happen to them. They need to know what to expect and what to do about it when it does happen. This is an example of a teaching tool to teach girls about starting your period or menstruation cycle. Soon I will get my period, like my aunt. This means I am growing up. Other girls my age are starting their periods too. When I get a period, blood will come from my vagina. This is okay. I am not hurt. My period may come every month. Periods are messy and can get on underwear and pants. I will use a pad in my underwear so the blood won't get on my pants. The pad may feel weird at first when I use it, but it will help keep my pants clean from blood. I will keep my pad on. I'll let you finish reading that on your own, but I just thought this is a great example of a tool that you could use to have a conversation with a child about preparing for starting your period so that they know in advance what they can expect. This is an example of a visual task analysis, or a breakdown of the steps to changing your pad. This can be used in a couple of different ways. First, it can be used as a visual prompt for the child to prompt them through the steps necessary to change your pad. Secondly, as the instructor, whether that means you're the parent or the teacher, I can use this checkoff list to help me know which steps that the child can do independently and which steps they still need prompting and cueing for. This tells me what areas to target my instruction in. Video modeling is an evidence-based practice. It has been shown to be effective for ages 3 through 22. Here are some tips for helping us to get started. First, identify the desired behavior. In a few minutes, we will watch a video model example. The desired behavior in this example is for the learner to change their pad independently. Next, we would collect some data. For example, can the learner perform some parts of changing their pad, such as maybe they can pull up their pants, or perhaps they can peel the sticky tape off the back. We've already established a clear goal to change their pad independently. So now we need to determine what type of video modeling will we use. In our example, it's video prompting. In video prompting, there is generally a black screen and it gives you an opportunity to hit pause between the desired steps of whatever activity is taking place. There are a few other types of video modeling, so basic video modeling, video self-modeling, and point of view modeling. You can learn more about all of those if you go to the Affirm modules that are linked in the slides in this PowerPoint. And I also want to remind people, when I am talking about video modeling, I am always remembering to be respectful of the participant. I am very careful to respect their dignity. So the next steps that we would need to follow. So we've already determined the type of video modeling that we need. We're going to use video prompting in our example. We need to record the video. In this case, it is not the student or child, it's an adult who is acting essentially in our video model. It is helpful to remember when using others as your example in video modeling, if you can get someone who has similar looks, similar height, similar age to your child, when possible, it will make your video modeling more effective, or it can make your video modeling more effective. Play the video for student at appropriate times. So prior to going into the bathroom to change your pad, I would have the student watch this video. I might have them watch it during the changing of their pad, essentially because this is video prompting, so I could hit pause between the steps. These are just some helpful tips to help you get started. Only video the desired behavior. So if I am filming and something happens during the film that is not the behavior that I want the student to be able to imitate, then I am not going to show that piece. I'm going to cut that piece of video out if I'm able, or I'm going to refilm. Always be respectful. I never want you to think that I'm saying video modeling means that you can film a student during their most intimate moments, or that you should be showing private parts of their body on film. Absolutely not. When I'm thinking of video modeling as a part of puberty, I am thinking it's more for self-care type skills, so changing a pad. I've seen some great examples of video modeling of shaving your beard, shaving your legs, taking a shower. It was done with a person in shorts, so it did not show any parts of their body that would be considered private. So always be mindful of that this is somebody's life, and they deserve dignity and respect. If you are school staff, always have parent permission. The parent should absolutely know that you are using video modeling, if you are filming their child especially. But there are lots of great examples in video modeling to where it's video modeling of others. So here's how you take off your coat, and it's someone else. It's not that child. Do not use your personal device. I think it's easy to fall into that trap because we all have a phone, or most of us have an iPhone or some sort of phone that has a camera on it. And, you know, everybody has a tablet, but I would not advise you to have video modeling of students, no matter what kind of video modeling that it is. And video modeling can be used for a wide variety of topics, not just puberty related topics. But I'm not going to have a video model of anyone else's child on my personal device as a school staff or clinical staff. Whatever kind of staff you are, I would not have that on my phone. So next, we're just going to watch the video model example. This is an example of video modeling of changing your pad. It will play automatically.
Step 1. Pull down underwear. Step 2. Peel dirty pad off underwear. Step 3. Roll up the dirty pad. Try not to touch the blood. Step 4. Throw pad away. Step 5. Unwrap new pad. Step 6. Peel off paper from back and sides of pad. Step 7. Place clean pad in underwear. If the pad has wings, fold wings around bottom of underwear. Step 8. Pull up underwear. Step 9. Wash hands with soap and water. Step 10. Dry hands.
Masturbation can be an uncomfortable topic for many parents and teachers. Masturbation also can carry the expectation of religious and cultural beliefs for families and school staff. These beliefs can impact our responses to this topic. You should remain calm. Do not yell or scream if your child or student begins to masturbate in a public place. We will talk about steps you can take to address this issue. How we address and handle masturbation depends on where it is taking place. If masturbation is taking place in a public place, try these tips. First, interrupt the behavior whenever possible. Remind the person of an appropriate time and place for this behavior, such as at home, in their bedroom. Redirect the person to an activity that requires the use of both of their hands, like playing on a tablet or giving them a fidget toy. Redirect the person to an activity that involves high amounts of physical movement. So go for a walk, get up, take a change of scenery, and do something else. Redirect the person to a place that has privacy. So a bathroom, a shower, a private bedroom, hopefully. Remind them about your earlier conversations about public places versus private places. This is where that becomes very important, that we've taught that skill. What is a public place? What is a private place? And eventually we expand that out to what can we do in a public place? What can we do in a private place? Provide a visual aid that shows when the person will get an opportunity to meet their needs. So maybe there's a schedule. Here's when we're going home. We're currently at the doctor's office, or we're currently at Walmart. We're going back home in 45 minutes, and then you'll have private time in your bedroom. If masturbation is occurring often in public places, consider these tips. Take some data as to time of day and the setting that this is occurring in. You may need to adjust your schedule to allow private time during those times of day. Also, check to see if masturbation is occurring due to boredom during those times. Maybe they are masturbating as a stimming activity. You may also want to consider, if masturbation is occurring in public, that you may need to look at the type of clothing that they are going out in. Maybe the loose, stretchy shorts might need to be traded out for shorts that button or have a belt to help restrict access to their private parts while out in public places. This is an example of a social story called My Special Private Times. My body is mine. I can touch myself. Some touches feel very good. I'd like to touch my private parts, but no one should see me touch my private parts. My bedroom is a private place. The bathroom is a private place. I will close the door so that I can have privacy. Touching my private parts is something I do when I am alone. If mom or dad knocks on my door, I can say, I'm busy. I can look at a magazine with pretty girls. It is okay for me to touch my own penis and testicles. My penis may go up. This is called an erection. It is okay. My penis might get big and firm. This is okay. It will get soft again. A little sticky liquid might squirt out of my penis. This is okay. It is not pee. It is semen. If my penis feels sticky, I will clean it off with a towel or washcloth. I put my clothes on and wash my hands when I am done. I don't tell mom or dad or anyone else about my special private times. Touching myself is one way I can make myself feel good, and that is okay. This is an example of a social story. I generally tell parents that this story is the starting point. You can edit this story to reflect your child's needs and your family's cultural beliefs. This is another example of a social story. It's called No Hands in Pants. I am getting older and my body is changing. Sometimes it might feel good to put my hands in my pants and touch myself. I cannot do this at school. It is not good behavior. I can only do this at home in my bedroom with my door closed. It is a private place. If I do this at school, it might make my teachers angry, and my friends might not want to play with me. When I keep my hands out of my pants, everyone will be happy with me. Masturbation can be a scary topic for both families and schools. We must approach this with calmness. We must also take a proactive approach that gives our students and children the skills they need to deal with this in a socially appropriate manner. Typically, developing peers are much more likely to pick up on the social cues, such as the looks on other people's faces if they should touch themselves in public. This is why we must teach these skills directly through social stories and direct instruction for our children and students with autism.